Hello everybody, again I am Dr. Nehal Mehta. Today we have a Dr. Munjal Shah along with us who is a pathologist, and we are going to talk something interesting about the pathology lab. So Dr. Munjal, so tell us, many times we hear that सब बोलते हैं कि report तो कहीं से भी करवा लो, कोई भी lab से करवा लो. So how important it is to choose the pathology lab correctly?
Good question, Dr. Nehal. So pathology labs are extremely important, and global statistics as well as studies suggest that up to 70% of all the medical decisions taken for a patient do rely on laboratory reports. So therefore, choosing the right lab can actually define your treatment and treatment outcomes and further management if required.
Dr. Munjal, can you explain this with some simple example?
Okay, like for example, blood sugar. Your diabetes does not always show all kinds of symptoms. But however, when we check the sugar, your value initially establishes the diabetes, whether it is there, whether it is pre-diabetes or diabetes. Secondly, once your doctor starts you on medications, then how much effect does that medicine has taken on the sugar will also be shown on the sugar report. So both ways, in diagnosing as well as in the effectiveness of treatment. This is only few of the examples where the laboratory reports are important.
Okay, so doctor, you are saying this is just a tip of the iceberg. Are there any other medical condition in which the report matters?
Absolutely. So when it comes to thyroid testing, your TSH will decide whether you have a problem with the thyroid or not, and the dosage of the thyroxine to be given will also be dictated by the TSH levels done in the follow-up testing. Similarly, cholesterol, a high cholesterol doesn't directly give you any symptoms, but only a laboratory test will decide whether you have a high cholesterol which needs treatment or not. Similarly, going ahead, vitamin D deficiency, vitamin B12 deficiency, they often don't give many symptoms in the initial stages. The symptoms come way later. But if you do a laboratory test to check your B12 levels and the D3 levels, you will often be able to catch them early, and hence your doctor will be able to treat them before any symptoms arise.
Okay, so this was something enlightening for all of us, I think. So from the pathology report, you can diagnose your disease even before you get a symptom, and treatment can be started on basis of that, and doses can be adjusted from the report. Am I right, doctor?
Absolutely so, yes. But in that case, there is one caveat, is that that report should also be right, which is
Correct. Correct, yes.
So which is where comes the question that how do you choose the right lab?
Correct. So yeah, so that's how the choosing a right pathology lab is very important. Dr. Munjal, how to choose a correct or good pathology lab?
That's a very good question and a very relevant question for all the patients who actually require any kind of testing. So let me give you a very few checklist points, right? The first important, very easy objective point would be to look for any accreditations. Now, when I talk about accreditation or certification, it has to be given only and only by NABH or NABL. Any other kind of certification or accreditation or certified lab, there is absolutely no guideline for that. Like, for example, you can say ICMR certified labs. ICMR does not certify labs for testing, for quality testing.
And what about ISO?
Even ISO is also not healthcare specific. So ISO has many different chapters, but NABL and NABH are specifically related only to healthcare testing.
Okay, so you are saying we have to look for accreditation that to only NABH or NABL, which is specific for the healthcare, and not ISO or any other kind of accreditation.
Absolutely, accreditation or certification through NABL or NABH only.
Okay. So, Dr. Munjal, apart from the NABH and NABL accreditation and certification, are there any other pointers to look whether this report is genuine, this laboratory is good or not?
Accreditation and certification take care of a lot of points. However, another certain points that as a patient we can always see, like how we always have this Graham Jago slogan. We can use the same for even you doing our own testing, because finally it is our personal thing. So as a patient, you can always go and talk to the pathologist in the lab, pathologist or any other lab doctor, a certified medical practitioner who is responsible for the reports of the lab. Now, why that is important is the Supreme Court guidelines suggest, that was released in 2017 in November, that every report has to be countersigned by a pathologist or a registered medical practitioner who has 6 months of training in lab medicine, right? So you have to ensure that all your reports have such a counter signing.
Okay. Dr. Munjal, many times we have seen on the report there is a signature of a laboratory technician, sometimes the signature of both pathologist also and a laboratory technician also. So what is your point of view on this kind of reports?
So in current context, in the current days, having a sign of the technician of the report is absolutely not required, right? However, in fact, I would go one step further and say that if there is a sign of the technician on the laboratory report, it should actually raise an alarm, and you need to go and check that lab if that lab actually houses a pathologist inside who's taking care of the reports, or he's not signing it just from somewhere remotely, which is also called as ghost pathologist in our industry.
Okay, ghost pathologist. We were not even aware such thing happened.
Yeah, so a ghost pathologist is a person who does not actually visit the lab, or the technician himself has just taken the signature of that pathologist without the actual awareness of the pathologist himself. Both things can happen, and as a patient, you have the right to know whether your lab report has been checked by the pathologist whose sign is there or not. Okay, so next time you see a technician's signature on report, that should be alarming. You should question that lab, and that might not be genuine. Right. Yeah. Also, this also brings me to another point that why the NABL and NABH accreditation are important. They also ensure that a basic test is not done. What is that? So a basic test is a very common slang term which is used for when a lab actually just generates the report without actually running the test on the machine. Okay, so like they are throwing in the basin. That's why it's called basin. The sample directly goes to the basin and the printer prints a report. Oh, okay. That is horrifying, I guess, for to hear this. That such thing happens. Absolutely. It's unfortunately being in the industry, I'm really sad about it, but this happens. Okay. So, Dr. Munjad, what is the role of pathologist, and even the pathologists are doctors? Because a lot of people feel that a pathologist and a technician is synonymous. It's absolutely not. A pathologist has done MBBS, 5.5 years of the entire MBBS, like all other general practitioners which you might have seen. Plus, they have spent another 3 years doing a postgraduate degree in pathology. Okay, so pathologist is the specialist doctor, not only MBBS. It's again an MD doctor. Okay. Absolutely. All pathologists have a degree of MBBS and MD. So, Dr. Munjal, what is the role of pathologist? Like you say, technician takes the blood sample, they put it in the machine and they run the sample. But so what is the role of pathologist in any pathology lab? So the pathologist is actually overseeing all the processes of the lab. They define the way that a technician should collect the sample, define the way how the sample should be run. So all those rules and regulations which are given by the NABH and NABL guidelines, they are ensured, the pathologist will ensure that they are implemented in the right manner with the right understanding by the technicians. Also, once these processes are run, and the raw data that comes out of the test processes, the pathologist makes sure that those raw data are made available to your treating doctor in a more legible and a better way, so that the information is conveyed correctly to the doctor and you get the right treatment and the right diagnosis. Okay. So thank you so much. The today's session was, I think, very much enlightening for all of us, especially the basin test, ghost pathologists. Those were the highlights. We were not even aware about this. So next time, guys, when you choose your pathology lab, don't see which is nearer or which is cheaper. Just see, is there a real doctor in the lab or not? Thank you. Stay tuned for the more updates. Bye-bye.